Good morning. Hello, everyone, and welcome to Enterra Medical's online discussion about gastroparesis and Enterra Therapy. I will start by introducing myself. My name is Breanna, and I am a patient liaison with Enterra Medical. I previously worked clinically as a physician assistant in emergency medicine and interventional radiology, where I frequently encountered and cared for patients with gastroparesis. My role now is to talk to patients like you who perhaps feel lost in their gastroparesis journey. And by lost, I mean that there are so many of you who may not feel like you have been given proper education about this illness. It may be that you don't know treatment options out there for you, or that you are not being heard by your medical team. It could mean that you simply don't know what's out there and you feel alone or underacknowledged. I've heard so many patients express that they have not been made aware of treatment options, that the symptoms they're experiencing are just in their head, or that they're just going to have to live like this. And I am here to tell you that those things are not true. So I hope that you find today's session to be empowering and educational in building your knowledge and giving you the tools you might need to take the next step in your journey. Who is Enterra Medical? Well, Enterra Medical is a company that acknowledges the courage and bravery of those living with chronic nausea and vomiting due to gastroparesis. Our mission is to raise awareness, provide research to continue to learn more, and ultimately be a source of support for you to find your way back to the dinner table and enjoy meals with family and friends. Today, we have the privilege of discussing a variety of topics. We will be joined by a gastroenterologist who is going to review gastroparesis with us, as well as provide an understanding of Enterra Therapy. We have a patient, Sadila, who is an Enterra Therapy recipient. She is going to share her story with us. You then will have the opportunity to ask questions. So we will have a Q&A with the panelists so that you can learn more. And lastly, we are going to provide you with information on where to access resources as well as additional support. Today, I am thrilled to be joined by two other speakers, Dr. Chokshi, who is an associate professor of medicine and gastroenterologist at Baylor College of Medicine in Texas. She has a passion for treating gastroparesis, and I think that you'll recognize that as she speaks today. Additionally, we have Sadila Hussain. As I said, like many of you, she has struggled with gastroparesis. She is now a patient advocate and is here to share her story. She is also an Enterra Therapy recipient. So without further ado, I am going to turn it over to Dr. Chokshi. Thank you for being here.
Good morning, Breanna. Thank you so much for having me. I'm just thrilled to be able to have this forum with which to share some of my understanding about gastroparesis and be able to share that knowledge with you guys today. So excited to be here. So I am tasked a little bit with talking about gastroparesis in general, as well as where Enterra Therapy may fit. So firstly, a disclaimer slide. It's noted that Enterra Therapy is approved by the FDA under the humanitarian device exemption, and it's specifically for the treatment of chronic nausea and vomiting that's been refractory to medications, secondary to gastroparesis of various etiologies in adult patients aged 18 to 70. So it's an important disclaimer to know about the therapy. So let's get started a little bit about what gastroparesis even is. So very simply put, this is a medical condition where the stomach doesn't empty as well as it should. And because of that, patients experience a variety of symptoms: nausea and vomiting, early fullness when they're eating or after they're eating, things like abdominal kind of pain, bloating, discomfort. All of these are symptoms that we hear very commonly. When these symptoms go on for a very long time, though, they can lead to other complications like low blood sugar or malnutrition and other complications. So it's not just the symptoms themselves, but what this can eventually lead to that we're really trying to make sure we're addressing. Gastroparesis has many different causes. One of those causes, and perhaps the most well-known, is diabetes or long-term diabetes. But there are many other causes as well. Sometimes this happens in patients who have had surgeries to the stomach area. It can happen for even unknown reasons. And in those cases, it's still important that your provider is thinking about how to treat you properly. So how it's diagnosed is the next step. How do we even get to the point where a patient has these complicated symptoms, which can be from a variety of different disorders, and narrow that down to saying they have a diagnosis of gastroparesis? So of course, we're going to start with a history and a physical exam. In these cases, it's oftentimes we utilize endoscopy in order to make sure that there's no structural reason that the stomach isn't emptying, say a big ulcer in the area or something to that effect. But then there's most likely some sort of gastric emptying test that's done, oftentimes a radiologic test where you'll eat a meal and they'll actually monitor that meal and take pictures every hour or so to see how well it empties through your system. And there are specific metrics to determine what is really normal versus abnormal emptying. A few other tests have been also kind of included in case there's things that need to be ruled out, but those are the primary things in terms of getting this diagnosed. After that is a very complicated care pathway. So the thing to remember here is that gastroparesis as a whole, despite the simple view of thinking of it as abnormal emptying, is really a complex disorder and requires us to think about it in a lot of different ways. And remember, we talked about the evaluation and diagnosis, usually an endoscopy to make sure there's nothing else obstructing the passage, and then a gastric emptying test that confirms the presence of delayed emptying. First-line therapies vary. They can include targeting glucose control in our diabetic population. Dietary modifications are really important. Previously, you would hear a lot of small, frequent meals, low fat, low fiber. But now it's really shifted to something called a small particle diet, which basically just means you can mash it with a fork. Can you make it small? So we still want you to eat your fruits and veggies, but maybe blend them, things like that, that make the particles small so that they can empty through your system a little bit more easily. Low fat is still preferred in these settings. There are a host of medications that can be implicated in gastroparesis. Narcotics are one. The new GLP agonists that are being used more frequently now are another. So targeting and reviewing medications can be helpful. And then there are some of the therapies that are used kind of as first line, things that might either move things through the system a little bit better, called the prokinetics, or things that are just really all about making sure you have less nausea and vomiting. And those are the antiemetics. But for a lot of people, just doing these things isn't quite enough. And so even though we try and work through each of these things and different options for medications, there are some people who require more advanced therapies. The advanced therapies include what you see here, and it includes gastric electrical stimulation, what the Enterra Therapy provides. It can even include procedures or surgeries that are directed towards the end part of the stomach called the pylorus, which might help empty it a little bit better. And sometimes other treatments are even needed, things like feeding tubes, something that might make it easier just to get nutrition. So really, this is a fairly complex pathway because no one person has exactly the same disease as the one sitting next to them. So the treatment process is multifaceted and can include a variety of options like you're seeing here. So if you're struggling to find relief, despite kind of moving through these pathways, it's worthwhile to note that you're not alone. This study noted that only 4% of gastroparesis patients reported being satisfied with their treatment options. And this highlights both the complexity of the disease, as well as sometimes our just limited armamentarium of treatment options that we can offer patients that really help them. So sometimes it's just not about focusing on the gastric emptying itself, but really the whole patient, all of their symptoms, and how to improve their quality of life. So with that, I want to start talking a little bit about Enterra Therapy and where that might fit in. What is it first? So first thing to note is that this is a gastric electrical neurostimulator, and it's the first and only implantable device that is really designed towards the treatment of nausea and vomiting. So what there is a neurostimulator like you're seeing here, and it's attached to two leads that we'll show you later that go into your stomach. And it delivers small electrical stimulations to gently stimulate your stomach. And in so doing, really try and relieve your nausea and vomiting. How exactly does this work? How does it get implanted? So this is usually a minimally invasive outpatient surgical procedure where the neurostimulator is planted just under the skin, usually somewhere in the abdominal area, maybe close to the belly button. But you can work with your doctor a little bit about where exactly it's located. The two leads that you're seeing now in this picture are implanted into the muscle wall of the stomach. And that's how it can send these mild electrical pulses that are really for your nausea and vomiting. How it can be changed or altered is via an external programmer. So in the office, we have a little programming device that we can utilize to adjust the settings of the system and help find that right level of stimulation that works best for you. The programmer also allows us to turn it on or turn it off. So the procedure itself typically is actually fairly short, takes about 1 to 2 hours. It's done under general anesthesia in an outpatient surgery setting, and oftentimes very minimally invasive, just the small cuts that are made into the skin so that there's not any big scarring. The procedure itself notes that the electrode that is located at the tip of each of those leads, that's the part that's going into the muscle wall of the stomach. And then the neurostimulator, which is attached to those leads, is placed just under the skin, again, usually above the belt line, and finding somewhere that's comfortable for you to maximize your ability to just live your life under normal circumstances and maintain normal activities. After the procedure, I'll say most people leave the hospital either the same day or just up to a day or two after. There is some pain associated with just having a surgical site, and that pain can be managed with medications. You can have that pain maybe up to 6 weeks to recovery. The stimulation is not something, again, that you necessarily feel. So it's oftentimes patients wake up and they're like, is it there? Is it working? But again, that external programmer will tell us if things are on and active as they should be. During your recovery, just follow your doctor's advice. Typically, you're gonna hear no heavy lifting, no excessive activities that involve kind of twisting or bending in that area. And your diet will have to be kind of continually modified as you get more used to the system and it starts working better. During that time, a lot of communication with your team is what's important, and you'll have various follow-up visits in order to adjust the settings. So more about that. So after the surgery, usually somewhere within the first few months, you're usually seen back in clinic, adjusting the therapy. This is that external programmer. You can see that the part that sits up against the stomach is very light. You're not even really pressing it in, but it transmits just fine, just like that. And then you'll get some adjustments based on your symptoms. You'll have an assessment of how much nausea and vomiting are you having now versus previously, and adjusting accordingly. This is non-invasive, it's painless, it can happen in the clinic. You will probably have a few visits over the first year. We oftentimes will do, 3 and then 6 and 12 months out for the first year, just to make sure it's being fine-tuned accordingly, and then any other medications or dietary treatments are being changed as they need to. The thing to note is that the stimulator is powered by a battery, and so over time, because of that, the battery will need to be replaced. And when this happens, you usually schedule a battery replacement surgery for that. All right, so a little bit to know just about Enterra itself. It's been around actually for over 20 years, and there have been an extensive amount of studies. Over 15,000 people have received it. And these studies are ongoing. This is a company committed to developing and researching more, and having many more hundreds of journal manuscripts going. But the biggest thing to know about the evidence about this therapy is nausea and vomiting. It really is designed to relieve that symptom, which is so important and such a big player in patients' quality of life. So it's really useful to know that that's where this really fits in. So some things to know that are not exactly correct about Enterra Therapy. So oftentimes, and I hear this every day when I get patients referred to me, they're being referred for the gastric pacemaker. And even though it kind of sits under the skin, like heart pacemakers do, Enterra Therapy is in fact not a pacemaker. It does not help your stomach technically empty better. Rather, what it is a neurostimulator that's designed, again, to relieve the nausea and vomiting associated with gastroparesis. There are some concerns that it's not FDA approved, but as I mentioned in the beginning, it has been FDA approved under the humanitarian device exemption since the year 2000. And with that, there's concerns about insurance coverage, but it is in fact covered by Medicare and many insurers, and worthwhile to at least talk that through with regard to your specific insurance. So, is it right for you? And that's really the question, right? That's why you guys are here. So what we know about Enterra Therapy is that it's intended for people who have gastroparesis that's either due to diabetes or even an unknown cause. It's for patients who are experiencing nausea and vomiting that hasn't been fully helped by medications. And it's for adults, for patients who are between the ages of 18 and 70 years old. But again, it's part of a multifaceted approach to therapy for a very complex disease. So it is worthwhile to at least ask your doctor and if this is something that's right for you or could fit into your treatment plan. Thank you guys very much.
Thank you, Dr. Chokshi. Appreciate your expertise and you taking the time out of your busy schedule to be here and share all of your knowledge with us. For anyone who has a question specific to Dr. Chokshi, feel free to submit those into the chat feature. And after we hear Sadia's story, we will have the opportunity for her to come back on so that we can ask her those questions. Now, next, I am thrilled to have the privilege to talk to Sadila. Sadila, thank you for joining us today.
Hi, Breanna. Thank you, everyone, for having me.
Yes, absolutely. There are so many people on this call today who can probably relate a lot to your story. And so we just appreciate, your vulnerability and being here and sharing your journey. Because yours is unique, but it's really an inspiration to so many of us.
Thank you. I look forward to it. I hope it resonates with some of the people listening today.
Absolutely. Well, let's go ahead and get started. So tell us from the beginning, when did your symptoms start and how did they impact your life?
So my symptoms started in 2011. So I was 21 at the time, and I was studying in university. And I just woke up when I went out for food with friends, and I started being sick the day after. And it lasted for quite a while. And I went to uh, my family doctor, like primary care physician, and they thought it was food poisoning, and they were like, "It'll go away in a couple of days." But it persisted. I couldn't keep anything down, and because I was studying for my finals, um, they was said it was down to stress. But it persisted even longer past my finals, and it kept getting worse and worse and worse. I was vomiting up to like 12 times a day, um, and they they were trying to give me anti-sickness tablets, but it wasn't really doing anything.
Yeah. So how long between when your symptoms started did it take for you to get a gastroparesis diagnosis?
Quite a while. So from when I saw my family doctor, it was about my family doctor tried to prescribe medication and try and see what they could do for about 4 months. And I tried multiple medications. They then referred me to a GI doctor, a specialist, and they did lots of tests. So they did, I think I had 4 endoscopies, CT scans, ultrasounds, x-rays. I saw a dietitian. I went dairy-free, gluten-free, meat-free. Anything I could cut out, I cut out and tried. I tried eating smaller meals, like smaller portion sizes, 5 times a day. I tried eating softer foods, just mashed up food. Nothing would help. As soon as I would like eat, it would even differ from what time. It could be 10 minutes after I've eaten or 10 hours after I'd eaten. I would still end up being sick. And that went on for about 18 months. And at that point, my GI doctor said they didn't think there was anything wrong. They said it's IBS. They tried to send me for mindfulness for IBS, which was not going to help because deep down I knew it wasn't IBS. I got frustrated with the GI doctor because they said, I think you're depressed. Maybe you should have some antidepressants. And I wasn't depressed. I was frustrated that my GI wasn't supporting me at the time and couldn't do her job. And I was quite assertive and said that to my GI doctor. And she said there's nothing else I could do, maybe go see a different GI. And they had a 6-month waiting list, so I paid to see them privately because I'm from the UK, so it's within the NHS. And there was a 6-month wait list, so I asked for all my notes. So when I looked at all my notes, she had written that it was all in my head, that there wasn't anything wrong, which then upset me and frustrated me more. When I paid privately to see the doctor, he said there's one test that hadn't been done, and that was the gastric emptying test. And when I had the gastric emptying test, in the 4 hours I was there, nothing digested in that time. And they said this was one of the worst scans that they had seen. So from that point, it was about 20 months that it took me to get my diagnosis. I was then sent to London for further testing, see if there's any other underlying conditions that would be contributing to the diagnosis, but there wasn't. So they stated it was like idiopathic, but they couldn't find a reason for the gastroparesis. And then they referred me to my now consultant for possible Enterra Therapy. Because in that time I also had Botox injected into my stomach to see if that would help, and that didn't help either. So I tried every option possible.
Yeah, it sounds like it. And what a long, time to just feel sick every day through that. So you said that they offered Enterra to you, and when they did, what did you think initially?
I was very apprehensive and negative when I went to see my consultant, and we still talk about that to this day, that first appointment, because I tried 10 to 12 different treatments that hadn't worked. So for me, it was quite a big step to take. Was this going to be another thing that doesn't work for me? But my consultant was reassuring and quite positive, and answered all the questions that I had for him. But for me, it was, I didn't have anything to lose. There was no other treatments that were available to me. I had tried every other treatment, so I felt like I had nothing to lose at the end of the day. It was just a risk I was willing to take.
Yeah, absolutely. Absolutely. Such bravery. So you decided to move through with it, and what was the surgery and the post-procedure like?
The surgery was okay. There was the normal anxiety you'd have about having any surgery. I think my biggest anxiety was it not working rather than anything to do with the surgery. And I had some pain when I woke up, but that was managed within the hospital with pain medication. I woke up the second morning and I was able to eat breakfast, and I was able to keep breakfast down. And it kind of felt in my head like, oh, is this actually happening? Like, am I able to keep food down? It was a very weird feeling to not be sick after a meal for the first time in over 2 years. To actually keep a meal down was a very weird feeling.
Wow.
A positive feeling, but a weird feeling that I wasn't used to. And then lunch stayed down as well. So yeah, that was after like over 1,000 days I kept a meal down. So it was a great feeling, and I thought, okay, maybe this is going to work. So it gave me that hope on the second day when I woke up.
Absolutely.
And a couple of weeks after that as well, I was starting to go days without being sick. So yeah, it gave me that hope that actually this is working.
Yeah. What a relief. What a relief that must have been after being ill for so long. So yeah, I mean, you kind of started to share a little bit, but what overall has Enterra done for you since that time?
I've said this to anybody that's ever asked me about Enterra or my illness as a whole. It saved my life.
Yeah.
I didn't have any quality of life before this. I was not going out, I wasn't eating, I was barely holding down a job. I wasn't able to go out and enjoy any time with friends or anything, because there was always that fear of, well, if I have something to eat, then how long is it going to be till I'm sick? And the fear of, if I eat this, is this going to make me sick? All of that is gone. It gave me back my life. It gave me a new lease of life. Um, at that point I was deteriorating, but now after I had like my surgery, I went back to university. I became a qualified psychotherapist. I work in the NHS, and I manage a team of like doctors and nurses. I see patients who come in with mental health issues, but they also they have seen patients who've had gastroparesis as well, and who also have chronic conditions. And it's actually being able to support them through that and actually educate some people on how to get support as well. So that's been great. I get a few episodes of sickness a year, if that. The longest I've gone without seeing my consultant has been 9 months, and that was just a checkup to make sure everything's ticking over. But it gave me back my life, and I always say to everybody it was the best decision that I ever made. And I have no regrets about it.
Yeah. Yeah, it sounds wonderful. I thank you for just sharing your story with everyone listening today. We really appreciate your courage and your bravery. If you had any advice for someone listening in, what would it be?
I'd say listening to your body, like when something's not right in your body, and you know your body best. You know when something doesn't feel right, and don't be afraid to go and get a second opinion. Because if I never went for a second opinion, I would never have got my diagnosis, and I would never have got my life back if I hadn't gone for a second opinion. So don't be afraid to do that, and that means advocating for yourself. So always just be brave enough to advocate for yourself. That would be my advice to people.
Yeah, I love that. I love that you give people that recommendation. That's something that when I talk to patients throughout the day, I try to stress as well. You know your body best, and you have to listen to what you think is right.
Yeah.
Well, thank you so much for joining us. We really appreciate you jumping on and sharing your story. I think it's relatable to so many people who have gastroparesis. So for anyone listening, if you have any questions specific to Sadila, feel free to submit those in the chat right now. We are going to go ahead and move on to the Q&A session. Sadila and Dr. Chokshi will be joining us, so feel free to submit those questions. We have had a few come in already, so we'll go ahead and get started as more roll in. Dr. Chokshi, it looks like the first question is for you. We are seeing some questions around what determines how long Enterra Therapy lasts, and if you need to get the device replaced over time.
Yeah, so as I mentioned in my portion, it is a battery-powered neurostimulator, which just as we have anything else that's battery-powered, eventually we'll need a replacement. So how long does that take? Well, it's going to vary between patients, and the settings may determine that slightly. But I would say on average, somewhere between 5 to 7 years. I kind of say 6-ish when I talk to patients about it, is what we tell people to expect. Couple things to note about that is that the programmer that we use does kind of give us a hint as to when the battery is getting low. So we can kind of preempt it a little bit and set up one of these battery replacement procedures. To know about that procedure, again, it's an outpatient procedure. It is usually kind of less of a procedure than the initial placement. Patients usually are able to recover much faster. So it does need to be changed at some point, but usually can be predicted and can usually require something that is less invasive than the initial step.
Yeah, great. Thank you for that. So next, Sadila, it looks like this would be a perfect question for you. We're seeing questions come in around your experience and what you started eating right after receiving Enterra Therapy. Can you tell us a little bit about that?
So when I was in the hospital, it was quite small portion sizes. So I think the morning after the surgery, I had toast and just a cup of tea, and soup. So quite liquid and small food. And when I went home, it was soups and kind of like mashed potato and quite small things that were quite easy on my stomach, quite easy to digest. I didn't want to put my body under any kind of stress. And then I think as the weeks went on, I slowly started to try like more food, like rice and things like that. And I think within 6 weeks, I was eating a normal diet. I didn't kind of cut anything out, but what I would say is it's just having that constant conversation with your consultant and always be in communication. Because if you're having any issues, it would just be like, am I okay to eat this? Or if something is aggravating your stomach a little bit more, then have that conversation with them. But my consultant always said, just try and then see how it goes. And that's how you'll kind of know. But now I don't kind of cut anything out.
Yeah, great. Thank you for that. Dr. Chokshi, at what point should you consider getting this device for nausea and vomiting caused by gastroparesis? And then what is the maintenance?
Good question. So, so we kind of discussed a little bit about how there's some initial therapies that are usually tried for gastroparesis. And I think you heard that the same sort of thing in Sadila's story as well, where we really try and focus on diet, try and focus on some medications that might help. But for a lot of patients, those aren't enough. And so there has to be at least a trial period of trying some of these things for the milder gastroparetics. But at some point you have tried things to, given everything a good college try, and you're saying, okay, I'm having a lot of problems. Specifically, again, for Enterra Therapy, you're talking about trying to relieve nausea and vomiting. So if all of those things have happened and you're still having nausea and vomiting, you have diagnosed gastroparesis, and you're between 18 and 70, it's at least worth talking about with your doctor to see if it might fit into your multifaceted treatment approach.
Yeah, great, thank you.
And then you mentioned maintenance, correct?
Correct, yes.
So we talked about kind of like the first year after placement, that we're checking in fairly frequently with the program or device and assessing symptoms and how things are going. And then oftentimes we end up at a place where we're like, okay, we're kind of good here, unless some, thing happens. I mean, even later down the road, someone who has gastroparesis might take a slightly longer time to recover from a GI bug, or something else can happen. But if overall you kind of get to those settings and levels that feel comfortable, you can, check in more like every 6 months or every year, depending on how that goes. As far as like the actual device itself, and Sadila, you can kind of answer this as well, there's not a ton to do. It's kind of just there. Hopefully you don't even notice it too much. So that's kind of what the hope is for maintenance part.
I'd say I don't feel it. I forget it's the majority of the time. The only time I would remember is if I'm going abroad, then I have to have my little card with me just to make sure that I have that on me to go through a metal detector. But other than that, 99% of the time I forget it's there. Because it just becomes a part of you.
Wonderful, thank you, thank you. Dr. Chokshi, again, we are seeing some questions around potential benefits and potential risks of Enterra Therapy. How do you answer this question when your patients ask you this?
Well, again, potential benefit is that you get relief of, again, one of the worst symptoms that's out there, which is nausea and vomiting. And I think that's a great potential benefit in an otherwise sometimes really tough disorder, right? I mean, patients are often really struggling. So I think that's a great potential benefit right there. Potential risks, of course, there's always the risk that it doesn't work for you, or that it's not the right thing for you. But risks as far as actual device placement, just like you might have with any potential surgery, you can have pain or infection or such at the sites. Overall, though, when the initial placement and all goes okay, again, it for a lot of patients just becomes their normal, and there's not a whole lot of changes or complications kind of later down the road.
Thank you for that. Thank you. Sadila, this would be best for you to answer. What would you say to a patient whose provider has spoken to them about Enterra Therapy, but they're really nervous about the procedure?
I would say just prepare yourself before you go in. So what I've always done whenever I'm going in for any health appointments is write down any questions that you've got, any anxieties that you may have. Just write all of those down so that you don't forget to ask them before you go in, to see them before you have your procedure. Just so you can have some peace of mind and you can sit down with family and write those questions down as well. Because sometimes when you're in that appointment, everything sometimes just goes out of your head and you come out and you say, I wish I'd asked that, or I wish I'd said that. And also working in healthcare, we have people come in and they record that appointment so that with the consent of the consultant, so they don't forget what's said in those appointments as well. So they could always do that as well. But I think it's just preparing before you go in. That's what I would recommend. That's what I've always done. And also kind of keeping a diary of symptoms. as well, just so you know kind of what's coming up for you. That's what I always did, was so I could kind of compare and say, actually, this is playing up more, or these are aggravating these symptoms, and I could kind of pinpoint certain things. So I guess it's that preparation beforehand. That's what I always recommend.
Yeah, I love that. I love that advice, kind of writing things down and bringing a diary and log of your nausea and vomiting. So it looks like we are seeing some questions about medications. Maybe Dr. Chokshi can answer this for us. So both in terms of what types of medications are taken to treat gastroparesis symptoms, and in terms of medications that are taken with the Enterra therapy procedure. And with gastric electrical stimulation, would you still be required to utilize medications like Reglan to stimulate emptying?
Yeah, so again, gastroparesis is a complex disease, and I mean, I can see 5 patients in a day who have it, and I'm going to get 5 different answers to these questions. The real things to know is what are our options and what do we have at our hands? Some of the medications that are used, you mentioned something called Reglan or metoclopramide, which is really the only FDA-approved medication that's out there for gastroparesis. It stimulates emptying a little bit, and so that's the reasoning for why it's used. That and some other medicines that are out there that are about stimulating movement, as well as medications that are oftentimes really more related to relieving symptoms, are kind of the combination that patients start with. And those, of course, can be adjusted. For a lot of patients, getting the stimulator obviates the need completely for medications. For some patients, they still use them on an as-needed basis. For some patients, they're still kind of incorporating it into their daily lives. And I think this is important because when you come for the visits where we're trying to adjust the settings, this is something that we're talking about is how much of your nausea and vomiting is still there? How much are you still using your medications? And utilizing the ability to adjust the system to kind of help with that. So the answer is complicated, kind of like the disease, but it really has to be taken on an individualized basis. And really we have to kind of utilize everything that we have together in order to make the best symptom outcome for, you know, each person.
Yeah, thank you. Thank you. You can continue to submit questions as we're going through here. Dr. Chokshi, another question for you. Will the stimulator limit my normal activities?
I hope that answer is no, honestly. Like the location of the device, and you know, really the goal is that you're not really feeling much. The aim here is that there is no real limitation of your normal daily activities outside of the 6-week recovery period just after it's placed. Maybe Sadila, do you have a comment on that also? I feel like you've told us before that you kind of forget it's there.
Yeah, I kind of forget it's like I think once there's that recovery period, like the 6 to 8 weeks, you can and in discussion with your consultant, you can slowly go back to like exercising. Like I've gone back to exercising, yoga, all of those things. I don't feel like it limits me in any way.
Perfect. Thank you. Okay, Dr. Chokshi, how big is the device? I think you briefly just touched base on this, and will people be able to see it?
Yeah, so it's like I said, it's about 2 by 2 more or less. And it is just underneath the skin. So unless you're looking really closely or feeling right up there, it's really hard to notice exactly where it is. Even when I'm in clinic and using my program, or I sometimes have to ask the patient, okay, where's your device? And they usually know. So it is designed not to be super noticeable.
We'll give it a minute to see if any more questions come in here. And if not, we'll go ahead and kind of continue on. So if anyone has any last minute questions, feel free to submit those. And it looks like we are going to kind of move on at this time. If you think of any questions in the meantime, we are going to provide you with access to someone from our team to be able to answer any other questions that you may have or think of in the upcoming days. Thank you, Dr. Chokshi and Sadila, for joining us. Now, thank you. So next, we are going to move to how to find out if Enterra is right for you. So there are two options. If you look on the right side of the screen, there is a QR code. Feel free to scan that. It will take you to a few quick questions to ask. Or if you go to www.enterramedical.com, it will take you to a home screen with a home page that looks similar to this. If you click Start Now, it will bring up some questions that will help you find out if Enterra Therapy might be right for you at this time. Likewise, if you are on our website, again, that's www.enterramedical.com. It will bring you to the home page. In the right upper corner, there will be a tab that says Find a Provider. Here, you'll have the opportunity to put in your zip code or the name of the city you live in and do a search. And then you will be able to find providers who specialize in gastroparesis and are knowledgeable about Enterra Therapy near you. Next, I would encourage anyone, again, to visit our website and view the resources page. So here there's going to be a plethora of tools that you can use regardless of where you are in your gastroparesis journey. There's a gastroparesis discussion guide. There is a short video explaining gastroparesis as well as Enterra Therapy. You'll have the opportunity to listen to other patient stories. And additionally, as Sadila had mentioned, we do have some diary tracking pages that you can print off to help track your symptoms and severity of nausea and vomiting. That can be a good tool to take to a doctor's office. And lastly, we have some dietary recommendations to follow for gastroparesis. And last but not least, we have an entire team of Enterra Therapy patient liaisons who are here to support you. We're here to answer any questions you have, provide education, try to connect you with a provider in your area, and really just here to support you on your journey and make you know that you are not alone and we are here for you. To access us, you can call us at 1-855-768-3772. We are available Monday through Friday, 8 to 5 Eastern Standard Time. If you catch us outside of those hours, feel free to leave a voicemail and we'll call you back. And again, this phone number is on our website. It's 855-768-3772. And now, on behalf of the entire Enterra Medical team, we'd like to thank you for taking the time out of your busy days to listen in. We hope that you found this session to be informative and encouraging for you to take the next step in your gastroparesis journey, and that step may allow you to find your seat back at the dinner table with friends and family. I want to thank Dr. Chokshi for your knowledge and expertise and taking the time out of your day to share with us. I want to thank Sadila for sharing her story with all of us and really giving us the courage to listen to our bodies. And I, again, just want you to know that you are not alone and we are here to support you. Thank you and have a great day.